Okay, so now on to what we will be covering today. We will first do introductions of our speakers, grantees on the call, and provide a brief overview of the Council of State Governments Justice Center, the Justice and Mental Health Collaboration Program, and the Bureau of Justice Assistance. Then we will jump into our presentation, which will discuss housing principles, building a framework for diversion in housing, and we will have the opportunity to hear about the work being done in Sonoma County. Next slide. So I'm going to turn it over to Charlie to start with introductions. Charlie.
Hi, everybody. My name is Charlie Francis. I am the deputy program director at the Justice Center. I oversee our national portfolio of housing work, which really we have one focus, breaking the cycle of housing instability and involvement with the criminal justice system. What can we do to connect the housing and homeless assistance systems, the criminal justice system, so prisons, jails, community supervision, and other partner systems like behavioral health? Get folks building relationships, talking to each other, aligning resources to really help break the cycle of housing instability and involvement with the systems, share resources, and really help people make connections with the housing that they need so that they get out of the system and stay out of the system, and that we're really, treating underlying issues and connecting people with resources, and and really reserving criminal justice involvement for the tools that it was originally intended for. So we do that across a lot of different buckets of work, including here the Justice and Mental Health Collaboration Program, which is really focused on the front end of the system, and diversion, which is what we're here to talk about today. So really excited to lead this work with my awesome team and to learn a little bit more about you all, where you're coming from, and kind of a little bit about what brings you here today, and kind of what housing issues you might be curious about or what you're dealing with. But first, I want to pass it to our other colleague, Thomas Coyne, as well, to introduce himself.
Thanks, Charlie. Yeah, really glad to meet everyone today. My name is Thomas Coyne. I'm a senior policy analyst here at the Justice Center, and I work on our housing portfolio with Charlie. And that includes providing training technical assistance to grantees and non-grantees alike. And really can't say anything about our housing work better than what Charlie just did. Additional perspective is, I come from the behavioral health field and have done a lot of this diversion work on the ground. So always happy to share some perspectives there. And I'll pass it over to our speakers, both Allison Lobb and Caitlin Dunaway, just to introduce themselves, and we'll pass it over to grantees.
Thanks, Thomas. My name is Allison Lobb. I'm a program planning and evaluation analyst with the Sonoma County Probation Department. I'm also a member of our probation's program planning, implementation, and evaluation team. And I have been able to be the program coordinator for our JMHCP program. And I'll pass it off to the representative of our wonderful community partner, Caitlin.
Thanks, Allison. My name is Caitlin. I am the program manager for JMHCP at Interfaith Shelter Network, which is the subcontract with probation to execute the JMHCP grant. So I'm also a clinician, so I have a little bit of both experience as a clinician, and then also as working my way up in the program. Started as an intern and now I'm program manager. So I've got lots of experience on the ground.
Yeah, thank you all for being here. So we see that it's quite of a bit of a small group. So we were hoping that we could go around just very quickly, if folks could introduce themselves and just where they're calling from in their program.
I'll start. My name's Joy Beeler. I'm from Mendocino County. So hi, Sonoma County. I'm a staff service administrator and I work in grant administration, and I am the point of contact admin person with our Stepping Up grant, which we have from 2019. And we're just nearing the end of it. Let's see, did you ask us to answer any questions or just introduce ourselves?
Just a quick introduction. That was great. Thank you so much, Joy.
Okay,
Thanks
thank
for being
you.
here.
I'll go
I'm just, yeah, perfect.
I'll go
Thank you.
next. My name is Colleen Engel. I'm the director of our local Winona County Criminal Justice Coordinating Council in Minnesota. I'm also the grant manager for our JMHCP grant. And apologies in advance, I'm going to have to duck out a little early because I've got other obligations, but I'm going to listen as long as I can. So thank you.
Thanks for being here. Next on my screen, Crystal.
Hi, I'm Crystal Martinez. I'm an administrative assistant for crisis management and also our new jail diversion program here in Big Spring, Texas. We're just getting rolling. Actually, we're not even rolling until September 1. So we're trying to learn everything we can, take it all in, and not screw up on September 1.
We hope we can give you some good information today. Welcome.
I look forward to it. Thank you.
Michael.
Hi, I'm Michael Duckett. I'm one of the planners with the Athens-Clarke County Police Department. It's here in Georgia. And I deal with 2 different JMHC grants, both 2017 and 2019. I work a lot with our behavioral health unit, but also part of our JMHC collaborative is the Sheriff's Department and some local health systems. So I work with them as well.
Great, welcome. And last on my screen is Patricia.
Hi, I'm Patricia Wallington. I'm with West Texas Centers, and I'm the Deputy Director of Behavioral Health and oversee this grant project here. And I work with Crystal. There goes my video finally. I work with Crystal, and so we are planning on opening our doors September 1st for our Crisis Receiving and Jail Diversion Center.
Great. Thank you all. Again, thank you all for being here today. Thomas, next slide. So really quickly, just going to run through some of the organizations today. So BJA works with communities, governments, and nonprofit organizations to reduce crime, recidivism, and unnecessary confinement and promote safe and fair criminal justice system. Next slide. So you all are familiar with the Justice and Mental Health Collaboration Program. Helps states, local government, and tribal organizations improve responses to and outcomes for people with mental health conditions or co-occurring mental health conditions and substance use disorders who come in contact with the criminal justice system, and to support public safety by facilitating collaboration among the criminal justice, juvenile justice, and mental health and substance use disorder treatment systems. Next slide. So the Council of State Governments Justice Center is a national nonprofit, nonpartisan organization. We combine the power of a membership association representing state officials in all 3 branches of government. And our staff really strive to develop research-driven strategies to increase public safety and strengthen communities. Next slide. And just a little more about how we work, clearly bringing people together at the intersection of criminal justice and behavioral health, driving the criminal justice field forward with original research, building momentum for policy change in this area, and of course, helping to provide expert assistance. Next slide. Actually, next slide, Thomas. Yep, there we go. Thank you. So the Council of State Governments Justice Center is committed to advancing racial equity, both internally and through our work with states, local communities, and tribal nations, with a particular focus on the criminal and juvenile justice systems. And with that, I will turn it over to Charlie to start our presentation today. Charlie?
Thanks, Ethan. I think, because we have a somewhat smaller group, also, I don't know why, I would love to see my own video on screen, but I don't, so hopefully everybody can see me. So So I think before we get into housing principles and evidence, because we have a smaller group, and this is a learning community, this isn't just a presentation. We really want to talk and have some dialogue. So, if I just want to create a little bit of space in a few minutes for folks to share, maybe, what brought you into this space? Are there any particular housing related issues that you're grappling with in your community? Are there any existing sort of diversion touch points that you have, maybe law enforcement or the courts, that you want to talk about or you'd like to strengthen? Just kind of like what's on your mind and where are you starting from as we kind of jump into this work? Don't feel obligated to share, but we'd love to hear from you. So I just want to create a space, for anybody to jump in. So feel free to unmute and just go for it because there's not that many of us.
I'll jump in. We are trying to set up a scattered site supportive housing program in our community. And I was interested in hearing about the work being done by the other jurisdiction.
Oh, great. And I'm curious, like what phase of the work are you in? Totally conceptual at this point. Have you started looking at funding or developing the project? Like where are you at with things?
We actually have money. We have ARPA money to fund the positions like the housing resource specialist. And we've kind of worked the program up, but we're having difficulty hiring someone. So that's kind of where we're at right now.
Oh, okay. Interesting. So you have the money to fund the units, but you're needing to staff to actually run the program.
No, we have the money to pay for the staff. We're just having a hard time finding people who want to do that kind of work.
Oh, I see. It's a recruitment issue. Yeah, curious if anybody else is. I mean, it's definitely not the first time we've heard something like this. Curious if anybody else has sort of seen like something like that in their programs they share, or if they're similarly kind of getting any housing programs up and running already.
Staffing is such a huge issue in Sonoma County. I think our reimbursement rates are lower than some of our neighboring counties. I'm talking specifically for mental health, like Medicaid payments, but so it's across the board. It's with our housing, it's with probation, it's with county, it's with behavioral health. It's a real challenge. I really hear you on that one. And I would like to add that one of our current struggles with housing is that our program is pre-trial. So people on it are technically innocent, which means that there can be a safety problem at our house. For instance, when someone should probably be urine tested, chemical tested for substance use, but that's not really probation's role in this case. So there are issues with partnering between probation and law enforcement and our provider to make sure people are appropriately monitored, but also being kept safe and being safe for others in the house, if that makes sense. And I'm sure Caitlin could speak more to that.
Yeah, that has been one of our challenges, and which kind of it alludes to a lot of the problems that come up is you have to come up with sometimes very creative solutions to problems that you don't foresee happening when you start the program. So we've done a lot of adapting to try to meet needs that we didn't foresee when we started running the program. But the transitional housing piece of the JMHCP funding is a huge piece of what we do to try to help people get into permanent housing, is starting with transitional.
This is great. This is the kind of start to the discussion I was hoping we'd have. Oh, it looks like Patricia wanted to weigh in.
Well, I was just gonna say that at West Texas Centers, we don't necessarily have like an actual program for housing, but we do receive funding from the state to provide short-term supported housing, which is only 3 months. So what we've done is with our grant, we wrote in there some client supports to have additional funding on top of those 3 months. That way we can at least get them going and provide skills training for them on like how to budget, how to, fill out a rental application in the beginning, that's a very basic type thing. And then how to keep a home, how to pay your utilities type thing, and then continue that so they can have that long-term housing type thing.
Now I'm very curious, where are other folks coming from? Because we already get a couple like key different housing continuum program types here. So I'm intrigued. Rest of folks, if you feel comfortable sharing, where are you at coming into this session?
We'll probably say this is a little out of my depth, just because we're on the police side versus the sheriff's side. But we were able to actually look at Savannah, Georgia. They have an interesting transitional housing. It's even somewhat permanent housing for veterans down there with a tiny home community. That was probably the most successful one I've seen, as far as they managed to, even if someone gets incarcerated for a little bit there, they'll keep the house there open for them. They can come back, and they've had very little, from at least when we went down there last year, they had very little law enforcement interaction while they were living there. So crime was pretty low. And that was just great to hear that they were able to keep that. And they also capped how much rent they could pay each month. It was a good stepping stone.
Great. So you see sort of another potentially model program that you're thinking about incorporating elements of that into your own work?
We've definitely passed it on. That's why I said I think I'm a little it's a little out of our department's hands here. The police department obviously doesn't do housing, but we took notes there and we brought it back to other stakeholders in our county who could possibly adapt that, or at least take thoughts and things that we learned from that and how we change our housing here.
Yeah, it's actually really interesting that you say that. One of the examples I'm going to share today actually was in Sarasota, Florida, their homeless outreach team, which you may have heard of. They've been doing this work for a while. Obviously, they don't do housing, but they were actually a real big part of sort of like driving change and how the housing system operates locally. So it might be a particularly interesting thing to key into. Anybody else that I missed want to share before we move on?
I just want to say that our grant wasn't about housing. Ours was more about data sharing and that whole piece, which is an important piece of the project. But we did everybody has housing issues, I'm sure, and trying to work it out. So that's why I'm here, just to find out if there's things that we can do. And we did just receive funding through the California Department of Healthcare Services that we're excited about. And we're just going through the agreement process to have bridge housing supports. And that bridge housing is going to include, a diversion and as part of it. So we're just going into it, and that's why I'm here to learn more.
That's great. You're in the right place. And if there's one thing that's been impressed upon us doing this work over the last several years, is how integral data sharing is to doing the housing work, especially around diversion. Because you don't even know who you're working with or where folks are coming from or what their needs are, unless you have some kind of robust data sharing system. And I think I see our friends from Sonoma nodding their heads. Anyone else before I move on? I think we hit everybody, but sure. This is great. This is one of the advantages of a small group. It's really great to know who we are and who's going to be together, and they'll just help inform our discussion. So now I'm going to go through kind of like our main content, but I think because we're such a small group, if there's anything you want to ask about, while I'm talking, just feel free to raise your hand or if you put something in the chat, maybe Thomas or Ethan, if you can just flag it for me, we'll just do things that way, because I'd love for this just to be really, really interactive and hope, you start thinking about how some of these principles can inform your work. All right, so next slide, please. So this slide really talks about what we're here for. I think we use this in every single CSG Justice Center housing presentation. It's all about, we are here to break the cycle of housing instability and criminal justice system involvement. I think everybody here probably already knows this, that too often, law enforcement, doesn't often have a lot of control over the laws and ordinances that they have to enforce, such as quality of life ordinances for, say, sleeping in public or going to the bathroom. We work with many police and sheriff's departments who have some discretion in terms of what they do enforce, but that often their hands are really tied, and that can really contribute to people getting swept up into the justice system, and it really creates this vicious cycle that makes it harder for people to get diverted. And there is research and evidence showing this. And then in particular, as people get more deeply involved in the system, having a criminal justice history is a huge barrier to securing housing, which further contributes to homelessness, and the cycle goes on. Next slide. Yes, we will definitely send out a copy of these slides after this meeting. And so this is another statistic that we often share. This is from a couple of key national studies. At least 15% of people entering incarceration experience homelessness in the previous year. We say at least 15% because the data is still not great, and a lot of estimates suspect that it's higher. And so why diversion? Because diverting people into housing is one of the best ways to break this cycle. Because, not only do we know this from experience, but there is more and more research coming out showing that so many people end up in jail, particularly, and going back to jail because they don't have anywhere to live. And so it ends up more quality of life crimes, community supervision violations, people just end up in jail on purpose for a short term because of nowhere else to live. I mean, we all know it's very sad. And this housing problem is not easy to solve, due to housing costs, connecting people with housing, discrimination and stigma. But diversion and getting people out of the system early is one of the best things you can do, because you're not dealing with as many of those barriers up front. And in particular, law enforcement and the courts, as well as others, but those two in particular can play a huge role. Next slide. And yeah, homelessness can be a revolving door to incarceration. I don't know if this script doesn't need a whole lot of explanation, but this is some of the more recent research that's been coming out, that homelessness is also a driver in incarceration. Next slide. So probably at least some of you, maybe a lot of you, have heard of the housing first approach. It's really more of a philosophy. And it's exactly what it sounds like, is that in many cases, and again, there's a lot of evidence to back this up, and a couple of the studies are cited below, but there's many more, that providing housing without preconditions like sobriety or engagement in treatment can be really effective to keep people housed, reduce returns to prison and jail, less contact with law enforcement, and it reduced costs to jails, emergency rooms, and other public crisis systems. It can be a little bit counterintuitive sometimes. And it doesn't work for every single person, but it works for many, many people. And Housing First is also not housing only. We don't require people to participate in services, but we assertively and frequently offer them. And what you find is that people will often, in the long term, engage in services more. And sometimes, even if it doesn't work on the first try, overall housing retention rates and returns to prison and jail are just so much lower. Next slide. And so what we're talking about in our housing work, we often talk about a continuum of housing options. And we even heard a little bit about that in our discussion today, which is why I love the fact that we had a little bit of time to talk first. Because we can contextualize things a little bit. Because you really need both short-term housing options to meet people's immediate needs. Because ultimately people need to be in permanent housing because it is a permanent place to live, but it's not always easily or quickly available. So if you can get people into permanent housing right away, great, do it. But you often need some really robust short and interim options that have good case management and transition pathways to permanent housing options. And the key permanent housing types, permanent supportive housing is a major one for a lot of the populations that we work with. No time limits with wraparound supportive services. It's a very research-based intervention for people with the highest needs. It is also expensive. Rapid rehousing is another key intervention. That's exactly what it sounds like. It's not necessarily one particular thing. It's more of a package of supports. It's typically people who need only short to medium term subsidy or services, short-term financial assistance, moving costs, landlord mediation. What do we need to prevent or mitigate short-term episodes of homelessness and get people stabilized in housing? And of course, there's a whole other universe of other affordable housing, Section 8 vouchers, public housing, etc., typically for people with less acute service needs. Next slide. So now, with this general grounding, I want to dive a little bit more specifically into a 4-step framework that we have to help connect people to housing, and then how that relates to creating more pathways for diversion, which is the topic of our series here. Next slide. And next slide again. So this is what we call the action points framework. It's 4 steps to expand access to housing for people in the justice system with behavioral health needs. We developed this a couple of years back. And what this is it's our synthesis of research, but also, the best thing about working at the Justice Center is that we have a nationwide perspective on working with grantees, practitioners, and other folks in the field on what they're doing and what works. And we just were noticing that, connecting people with housing and diversion and reentry is hard work. We all know it. But there are we're just amazed at the common themes that we are seeing in the emerging and best practice programs that we're working. And so we tried to distill what we were seeing as the common themes in what works and create a flexible framework that could help people understand how to move this work forward. Because it's not just about doing one thing. If it was that simple, we would have fixed the problem already. It's about building relationships, understanding people's needs, and then I think maybe the trickiest part is balancing competing time horizons. Connecting people with housing to meet their immediate needs, but also I think we all know there's nowhere near enough affordable housing out there. So we need to be doing this connecting work while at the same time working on a system-wide level to expand the supply of housing if we ever want to make a longer-term impact. So that's kind of what this framework is about. Next slide. So step one, collaborate. The foundation of everything. I don't know any diversion or reentry housing program that works in this space that's not built on a foundation of some kind of cross-sector collaboration. And I don't know any example of cross-sector collaboration that wasn't built with a whole lot of time and patience. And I bet our friends from Sonoma will probably have something to say about this as well. Yep. So this is definitely what we preach. A couple of key strategies, and we'll share a link to our brief on this in the end if you want to read more about this, but ensuring cross-sector representation in key planning bodies. So what does that mean? So like a continuum of homeless assistance continuum of care, for example. For those of you who don't know, that is typically a local, regional, county level planning group, usually run by a nonprofit lead agency charged by HUD to distribute HUD homeless assistance funding and do general needs assessment and planning for homeless assistance needs in a community. Having folks from the criminal legal system join the COC board is an incredibly important strategy, because that is where policies and procedures are made for who gets prioritized for these housing resources. So that is always time well spent. And then some of the other strategies here are, formalizing collaboration mechanisms a little bit more. I know Joy was talking about data sharing, MOUs, very important. And then facilitating regular cross-system training. I really can't stress that one enough. We can never take for granted that folks across different systems may not speak each other's languages, know the resources available, or, folks, say in like a regional parole department, may not even know who their continuum of care contact is. Next slide. So a good example is in Wichita, Kansas, their homeless outreach team. So for those who don't know what a homeless outreach team is, just real quickly, it's a dedicated arm of the police department. Sometimes it may just be police officers. It may also be, a collaboration of police officers, clinicians, and other, who may or may not work for the police department, and other community responders. Often most of the time, they don't actually conduct any enforcement, but they focus on outreach and relationship building and connecting people with resources. And it is definitely best practice in this space, and Wichita was one of the first places to do it. And so basically they are, sorry, give me 1 second, I'm gonna go to a computer issue. Okay, there we go. So just what I was talking about, the continuum of care, Wichita PD has been on their continuum of care board for years. They have a good collaboration mechanism with the local jail to help get people IDs and documents. And because of this collaboration, the COC actually prioritizes rapid rehousing people resources for people identified by law enforcement. Next slide. Next up is assessment. So unlike in the reentry space, this is, we're most often talking about a jail population here, or folks who would likely end up in jail. There's not much time to plan a long process for assessing someone's housing needs, whether, they're being encountered by a law enforcement officer or in a crisis stabilization unit or in court. You want maybe a short set of questions or an interview or a screening instrument to quickly be able to understand what their needs are. And you want the resources and expertise within your community, or like talk to someone like us who can help connect you with other sites to see how they've integrated this into their workflows, because it's a challenge. It's definitely a challenge. And it's another thing I think Sonoma was going to talk about today. And then and also just being able to report publicly on risk and housing needs in the community. Next slide. And this is where I really want to highlight Sarasota. I'm another longstanding homeless outreach team. They've done some similar things to Wichita. But and like I said before, they were really instrumental in help driving change within their local COC towards more faithful implementation of housing first, because of that long-term implementation. And they were actually able to help also get some dedicated resources for short-term housing at their local Salvation Army. So when they encounter somebody on the street, they're able to get them directly into housing and then connect them with the COC. It's still not enough, but they're able to get that resource. And they have their own dedicated city case managers who keep notes and assessments that are separate from law enforcement records, and so that is the assessment piece. Those case managers are out there assessing, they're trained and understand how to assess people's housing needs. And those folks don't work for the police department. At this point, their hot team, has somewhat shifted over to the city. So it's a collaboration. And then Sonoma is also going to talk more about this in depth as well too, so I'm not going to spend a ton of time on it. Next slide. Step 3 is the all important connect. If you really want to divert, diversion in general is all about connecting people quickly to resources in a moment of need. And so housing is no exception. So you want help, homeless outreach teams and community response teams, embedding an entry points to the homeless assistance community of care so people can be assessed and connected to what's called the coordinated entry system, which again, something that HUD requires, which is a community-wide infrastructure that, where people are supposed to have their housing needs assessed and then entered into a community-wide data system called the HMIS, the Homeless Management Information System, to be able to prioritize and connect people with housing resources on like a community-wide basis according to need. Does not always work perfectly, but law enforcement, crisis stabilization, courts, jails can all be places where people get directly connected into this system with their own staff or with partnering behavioral health type agencies. Also connecting with housing, like I was saying before, particularly with communities of care or housing authority leaders. You want there's just not enough housing, and having those conversations, like one of the folks shared earlier that they're using ARP resources for this population. I'm sure that didn't happen in a vacuum. Those resources didn't come out of nowhere. So like you were doing that, and so kudos to you. And then participation in corrections and health information exchanges is another great data sharing strategy that can help connect people to housing. Next slide. So this is, some of the examples that I've already shared are also doing this, because this is these steps don't always kind of neatly fall into distinct buckets. But in Burien, Washington, King County, I believe, they provide their, so they have an outreach team with law enforcement assisted diversion. So they receive referrals from the police department, conduct street outreach, and that's an entry point services. So it's similar work to what Wichita and and Sarasota are doing, just led by different folks. They supplement outreach with case management. But I think the difference is it's just, in this case, it's run by a different cast of characters. The referrals come from a different place, but kind of across these different communities, these consistent themes that you're seeing are like building these relationships, establishing priorities, and real-time cross-system data infrastructure are the things you really want to be thinking about. And a lot of these have been kind of law enforcement centric examples to start. But some of these principles also apply to other stakeholders as well, such as a court, like a problem-solving court, for example. Similarly, you'll want to create an infrastructure, for staff working with their clients. You'll also want to have a good case management infrastructure, be able to assess housing needs, and have a robust referral network. So all of these same principles still apply. It's just the intercept point is different, if that makes sense. Next slide. And then finally, expand. My favorite step, because in addition to always building relationships, the other thing I always preach is there's just not enough housing, and we need to do whatever we can to get more of it. So using data to advocate for that investment, leveraging no-cost resources whenever we can, like surplus land. Number 3, I really want to dwell on for a second. HUD is wonderful. They do great work. But like, we cannot just rely on housing system funding to solve this problem. We need to bring in DOCs, sheriff's departments, health plans are getting into the space, philanthropy. We really need to be looking at all the resources that we can. And we can't forget racial equity. As we're investing in different communities, who is being served? Are we putting in place the data infrastructure to understand who's getting referred to these programs? Well, how does it break down along racial and ethnic lines? It's really important that we don't forget about this. And that's really centered in all the work that we do. And I just also want to say that on the criminal legal side, we've seen a lot of examples where diversion partners can really be the drivers to expand housing options. Whether it's bringing new resources to the table or help making the cases around the fact that we're all serving a shared population. The same folks being encountered by the criminal legal system. In a lot of cases, there's a huge overlap. That those are the same folks being served by the housing system and the behavioral health system. And the more that case can be made with good data, the easier it is to bring those partners along. And many places are also doing this on a larger scale. For example, departments of correction, not exactly a diversion context, but the principle still applies. Using data and relationships to make the business case for why investing housing resources in this population is a good investment of money, saves public funds, and gets people housed. And just building relationships and being patient. Next slide. So one community example is Cuyahoga County. I really like this one. And this one was actually led by the courts. I'm blanking on what the name of their state court system is right now. Maybe Thomas can pop that into the chat. It's completely escaping me. But we've worked with them quite a bit. And what they did is back in 2018 or so, they did a sequential intercept mapping exercise to really try to understand better where people who are frequently cycling through, what we often call the familiar faces population, or, for frequent utilizers of the criminal justice, emergency medical, and other public systems, how many times they were coming into jail, how frequently, where else they're being encountered, and how much, they were costing in public funds. And they were able to get some really, really robust data. We worked with them, to support a statewide infrastructure for that. And they were actually able to make the case to get some state criminal justice block grant funding. It wasn't housing specific funding, invested to start a new 15-unit permanent supportive housing program to prove their model locally. You know, it's a small program, but we often tout this example because the principles apply. You know, it took time and data coordination infrastructure, but if you can show local decision makers that these people are cycling through different systems, who they are and how much they cost, you know, there is definitely a financial case to be made. All right, next slide. So I just want to take a couple minutes, you know, before I turn things over to Sonoma, to give folks a minute to process. I think we've already talked a little bit about how we're undertaking some of this work. But you know, just for like the next 10 minutes or so, you know, how does this intrigue you? You know, what thoughts does this bring up? And you know, have you heard anything intriguing, interesting, or challenging in here that brings up any questions or next steps or implications for some of the things that you shared that you're working on? I mean, we can take down the slides for a minute here too.
There were two things that kind of came to my mind when you were talking. One is our grant is actually also helping to fund a data system. So hopefully that data system, once it's in place, we'll be able to track some of the familiar faces that we see with our behavioral health team. Also, we know a lot of them are coming from other counties. They're not even from, because Athens is kind of the city, you know, in the area. So other counties are dropping off folks. Hopefully that will help us track it.
Yeah, that's a great example of why it's so important to get a data system going, because if that wasn't the case, you would have no idea where people were coming from.
Yeah, I mean, our teams very much recognize, you know, a lot of our locals, we'll say it that way. So they knew people were coming from other counties, but it wasn't until later we actually started asking point blank, you know, how'd you get here? And they'll be like, oh, the sheriff's office next door dropped us off in an Uber. So to be able to have that data system is so important for us.
And Michael, I'll say, you know, one of the counties that we worked with in Ohio, they did that same work of trying to figure out where people in their case in their jail were coming from. And they found also that a couple of counties were taking people to jail. In their case, it was that their local police departments and some of the surrounding sheriff's departments just didn't have quite some of the information on like crisis systems and other diversionary pieces that the county who had the jail and actually had some of the crisis pieces together. They didn't have that same information to try and divert people. So like, oh, well, where are we sending people in crisis? Well, we're going to send them to the jail because that's the lever that we know to use. And they use that data, I think, kind of how you're planning to bring it back and provide some education to their partners, which, you know, having that peer-to-peer conversation can be incredibly powerful.
We definitely hope something like that will help us when we talk to the partners. The other hard part I know for housing here, because our jail does have a transitional team, they're actually trying to ramp it up right now. But we're a college town. So the county only has about 110,000 people, but the college is 36,000 because we are the flagship University of Georgia. And so it's definitely hard sometimes to, you know, well, University of Georgia Police Department handles this, we handle this, but they're a UGA student. How do we manage that? And then with the housing, definitely having that large student population has created such a shortage of affordable housing in our county.
I think something with what West Texas Centers is trying to implement is we work very closely with our law enforcement, and we're a small town. We don't have anywhere near the capacity that some of y'all in California and Georgia have. But something that we have worked out with law enforcement and ourselves is that this isn't really like a walk-up style receiving center. The only way to get into our jail diversion is it has to be communicated to us through the law enforcement center. Patricia, you may have to correct me if I'm wrong, but I do think that we have it worked out with paper and the call system and the buddy system and whatever else, but we have a system worked out to where they're going to call us and have the paperwork as much as they can pre-filled out. And then I'm going to do some of the intake for our jail diversion clients and help fill in that gap there with financials and helping them move forward from the drop-off point.
Yeah, you're absolutely right, Crystal. The only person that can drop off is law enforcement. That's just the way we did it. And especially in the beginning, and it's 100% voluntary program. And then Crystal will do all the administrative intake type work.
Yes, we just didn't want them coming in from every different angle, and we don't know who, what, when, where, why. We don't know, we know nothing, and we didn't really want that sort of environment with a walk-in style facility. So it has to come strictly from our law enforcement center, and they're receiving training also. We do have mental health deputies here that have been trained and continue training in trying to help. They're specifically for our crisis and the mental health need that we have in our community. And our community is hurting pretty heavily. I'm sure like everybody else with the narcotics and everything, but we have deputies that have trained specifically for dealing with mental health clients and patients. And so we serve 23 counties, and we're working on getting that advantage in all of our counties, but we only have it here in Howard and I believe Sweetwater. And I feel like there's another one, but I'm still learning all the ins and outs of everything right now.
Just to clarify something there, so you're the 23 counties, the center serves 23 counties?
That is correct, yes. Yes, West Texas Centers as a whole serves 23 counties here in Texas.
Yep. Okay. Right.
Other thoughts or questions or for us? I know, we probably have other community examples that can come to mind or things that we can clarify. I also love the dialogue that's already happening here. So we definitely have a few more minutes for conversation before we move on. Going once. Twice. 2.5. 2 3/4. 3. All right, cool. All right, so if we could put the slides back up. Go to the next one. And the next one. So ultimately, we are here today as JMHCP grantees, and we are so pleased to feature the work that Sonoma County originally launched under JMHCP and has been able to continue. They've done some really great work to be able to, assess, do so many of these steps, build relationships, assess people's needs, and connect them to housing, and really do some really great diversion work. So they're going to share, Allison and Caitlin are going to share with us, some of their work today, how it came about, what they do, and their lesson learned. So Allison and Caitlin, go to the next slide and take it away.
Thanks. And our division of labor here is, I'm just going to go first and provide a little background, a little bit of insight. Well, I hope lessons learned on on the grant administration end of things and coordination end, and then Kaylin really knows how the rubber has been hitting the pavement in working at the front lines of this project. So I'm going to expand the history a little bit beyond this slide. We started with Sonoma County. Well, first of all, what is Sonoma County? It's a county about 70 miles north of the San Francisco Golden Gate Bridge. I know you can, my Mendocino colleague, you can tune out for this part, because Mendocino is the next county north of us. So we are a very large, geographically relatively large county, but we have about 500,000 residents. So we're very rural, agricultural, think wine country. We're between Napa and the Pacific Ocean, a lot of coastline. And then we have like a pearl necklace of urban centers stretched up the middle of the county through our main highway headed north to Mendocino. So in 2015, at the beginning of 2015, we launched a pretrial release program, which would let people out at arraignment or at the second court appearance. The court could grant their pretrial release based on a risk assessment, and the risk assessment assessed the likelihood of a person committing another crime during their pretrial period or failing to appear to their court dates. So very quickly, we noticed that people living with mental health challenges were not being released at the same rates, just regardless of their assessment scores, risk assessment scores. And thank goodness we have some active disability rights advocates in our county that wouldn't let us ignore the problem. And so the county, shortly after that problem was brought to our attention, joined the Stepping Up initiative and applied for our first JMHCP grant, which was a planning and implementation grant. And it was a pretty skinny grant in terms of the services we were able to provide. It was a clinician in the jail who could screen people, create a discharge plan, present it at court, and then provide a warm handoff to the next step that the person was going to take out of the jail and into their first service provider. And the main partners in the grant were the probation department and the behavioral health division. And actually in the first grant, there was not that much partnership with Interfaith Shelter Network. It was basically, there you go, good luck. But we also had a pilot program of 8 to provide transitional housing to 8 people, which we did also do kind of late in the game. We then applied for a second expansion JMHCP grant, an expansion grant, and that was where we really felt like we started helping people a lot more. And that grant supported a dedicated 8-bed co-ed supportive transitional housing facility, and with lots and lots of services. And in addition to that, 8 beds is not that many. We also started a community-based case management program. And I wanted to just read to you the different services that we had on offer with these programs. So in the expansion grant, of course, inside the jail, the clinician was doing a records review, a mental health assessment, and a substance use disorder assessment, if that was indicated by the person's condition or history, and a discharge plan, and then the warm handoff to the next service provider. In many cases, thank goodness, working with our wonderful community partner, Interfaith Shelter Network, the new list of services in the community were at intake, a full biopsychosocial strengths and needs assessment. We actually provided our IFSN organized transportation from the jail to that assessment. Then a collaboratively developed treatment and stabilization plans were done. Individual counseling sessions are provided by IFSN for people who don't have another source of counseling services. There's accompaniment to court, transportation to medical and mental health appointments, healthcare, food and benefit assistance, and assistance accessing other services as needed, like 12-step programs and housing assistance programs. And then some people don't need a whole lot of help, but they still get a friendly contact from IFSN at least once a month, just to make sure they still don't have needs that aren't being met. So all of those are available to everyone in the program, whether they live in the house or not. For people who live in the house, we also provide, of course, that safe, sober living environment. There are weekly therapy groups held there, weekly life skills classes held there, and just a wonderful, bright, clean, nice environment. So let's see, just to talk about, one thing at a time. So over those, whatever it was, 5 or 6 years of the grant, we were enabled 275 individuals to be released pre-trial who would not have been released otherwise. And we housed a total of 54 people just during that grant period. And of course, it's been continuing. The expansion grant, we closed it out and completed all our commitments last March 2022. So, so even more people have been helped since then. And I wanted to also just let you know a little bit about the outcomes of the expansion grant. So, as I said, we already had a pretrial release program. So JMHCP participants had new arrests. About 21% of them had new arrests during their participation, compared to 15% of the whole pretrial population. And then all participants had about 19% of them had violations, compared to 16% of the whole pretrial population. And then the failure to appear rate was actually lower, 25% compared to the 26% for the whole population. But for those who were housed, they only had a 10% rate of new arrests, a 10% rate of violations, and a 10% rate of failing to appear to court, compared to the pretrial population as a whole. And looking at successful completions of their participation, a successful completion for us just meant you made it to the adjudication of your court. So during the pretrial period, you were part of the program until, your charges were dropped, you were adjudicated, or you graduated to mental health diversion. So for the overall completion, successful completion rate, just during the 2 full years of our expansion grant, the overall success rate was only 49%. But for people who had the community-based case management only, it was 69%. And if they had community-based case, any sort of engagement in the referrals that they received from the community-based case management, that their success rate was 77%. And let's see, I wanted to also touch on just the things that I felt were really important to our success. One is having a program coordinator. In this case, it was me, so I'm going to promote myself as being a key to success here. But it's just that when you, as I'm sure many of you know, when you write a grant, you have 6 weeks, and it doesn't necessarily reflect reality, the true needs and what's happening on the ground. And especially in these collaborative programs, it's just really having someone to kind of provide the connective tissue, keep people in track. I certainly don't have any decision-making authority or any, I don't supervise anyone. I just kind of am a communication point of contact to try to hold things together and make sure we're on the same page and make sure things are moving along. Good collaboration is so essential. And let's start out with our community partner, Interfaith Shelter Network. We know that it takes time and effort to collaborate. So we wrote into our RFP and their contract, we wanted them to call out. We stated, we expect you will need to spend this much time in meetings, and you also will need to spend a lot of time collecting data, and we want you to show that in your budget. how you're gonna make sure that someone's available to come to the meetings and to do the data piece. So I think just recognizing that burden to our partner was important, and them then thinking it out and really asking for what they needed. We had really good collaboration with our justice partners that already existed before the beginning of the grants, but it really strengthened through the grant. We have our oversight body consists of high-level officers of our criminal legal system, plus representatives of our community-based services, plus representatives of our peer-led organizations locally. And that's just been a really huge advantage to getting support with things and problem solving. We also have an implementation team that includes people who are actually doing from the operational level. So we have the service provider from IFSN there. We have a probation officer there. We have our clinician from the jail there. And then also representatives of provider organizations that aren't directly involved, and also people with lived experience. And that's been really helpful to design outreach tools for problem solving in real time. It's been a really big help to solve problems at that level, but they can also be elevated to higher levels directly from there when needed. Let's see, I would also say, draw on CSG for resources when you need to. I think probably all of you have already submitted your planning and implementation guides, and it's important to collaborate, of course, with CSG on that. CSG sometimes is even more strict than the BJA might be, and we found a couple times we had to push back to get our plan to really reflect the reality we ended up experiencing, as opposed to what the firm grant commitments. Do your GAMs, your grant adjustment modifications when you run into different situations. One of the real strengths of our program that Caitlin mentioned was our ability to adapt to different needs that, unexpected things. We had 4 major wildfires and 1 flood. We had the pandemic, of course, which also threw the house into quarantine a number of times. And through really open communication and collaboration and joint problem solving, we made it through all those hurdles. Also having the voices of the people we serve and our partners has helped secure our continued funding. They could advocate, they could help spread the good reputation that we've gotten, and really convince the powers that be that we were deserving of continued funding. So I'm trying to see, I made notes, that's why I keep looking around. I didn't want to forget anything. And I think, training, that was mentioned in the presentation, but it's also really important. One of the biggest hurdles we had to actually launching our program was really getting the justice system partners aware of our program and how to use it. So we had a training for judges, and we had another joint training for members of the district attorney's office and of the public defender's office. And that we really couldn't get off the ground till we had that kind of collaboration. And finally, I would say for this population, it's just been so wonderful to have a community provider, IFSN, that provides both the housing and mental health counseling and a real awareness of mental health needs and the mental health services environment in our county. So I would be really happy to get questions later on. Oh, I wanted to say one more thing, and that was we used part of our first grant to do a sequential intercept mapping workshop. We had like 45 representatives from all the different county agencies and providers, community providers. And so that was, let's see, we did it 5 or 6 years ago. We have used that document over and over to apply for funding, identify needs, document it's a real need, and show that it's part of a continuum, a network of potential care. That it would be connected to a network of care. That's what I was trying to say. So I'm going to pass it on to Caitlin to talk about how things work for real. And I'm happy to take questions or comments later on. Thank you.
Thanks, Allison. So I'll just give you all kind of a quick little synopsis of what IFSN does as an agency and then how that correlates to what we're doing with JMHCP. So Interfaith Shelter Network is a local nonprofit in Sonoma County, which is primarily a homeless service provider. We serve lots of probationers through a different program. So we've been cultivating this relationship with probation for quite a long time now. We also have contracts with our local family, youth, and child services, so local CPS, to hopefully get families back into housing, to hopefully reunite with their children. We have sensitive needs houses. We have a transitional age youth program. So we've really been doing a lot of the homeless service providing for a very, very long time. So I think the partnership to take on JMHCP was a pretty natural, easy fit for us to be able to make those needs work for what probation was looking for. So we're a housing first agency. We are a harm reduction agency. We are very low barrier. So if probation will refer them, we will serve them as long as it's safe to have them in transitional housing. And if it's not, we will still take them on community-based caseload. So if they're unsafe to be housed with other vulnerable populations, which is primarily the biggest thing that we're assessing for, is it safe for the other clients? If not, we will still serve them on community-based. We might just only see them in the office, or we might meet them somewhere in the community to be able to make sure that we're providing services for as many people as possible. One of our foundational beliefs as an agency is that everyone deserves therapy. It doesn't matter what your socioeconomic status is. It should be something that's equal to everybody. So we provide free therapy forever for anyone who has ever been a client or any immediate family members, if you've ever been in our program. So that was very natural for us to embed into the JMHCP contract. We usually are able to find our clinicians as interns from universities who are working on their LMFT or MSW hours. So helps them, helps us, helps the community. So it ends up working out really well in that way. That's the way we're able to sustain that program, the clinical program. In terms of, you mentioned rapid rehousing, and we also practice that as an agency. We use the progressive engagement model, which is a little bit different than a lot of places. So typically rapid rehousing goes 90% of help, 70%, 50%, 30%. It's very structured in how many months they'll receive subsidy. We don't think that works as well as progressive engagement. Progressive engagement says, maybe this month you need us to pay 80%. And between now and next month, we're going to look at your bank account. We're going to look at your budget. Maybe your car broke down and you need a little bit more help next month than you did this month. So it's as light touch as possible while still helping the person maintain housing, develop those skills to maintain permanent housing in the future. So in terms of how all of those things have translated into JMHCP, the most important piece is, I would say, is that we're as low barrier as we possibly can be. So people get ruled out typically because the court won't let them be in the program, not because we won't serve them. So there's some automatic rule outs depending on your charges that we have worked with probation and the courts to be able to change. So they've become, those barriers have gotten lower over time. But there are still obviously some people that don't qualify because of their charges and what level of pretrial release they're on. Another very important thing about how we're running JMHCP is that we have clinical staff that work in the program at some capacity, whether it's a clinical case manager or a clinical supervisor, to help with consultation around client care. So a lot of that has to do with, are we being trauma informed? Are we looking at our own countertransference or transference from clients to us and how we're treating their case management? So that's a very important piece. I think those two things being low barrier, having trauma informed or clinical staff working with those clients. Obviously being a housing first model is very helpful. And then meeting the clients where they're at. And sometimes that means physically meeting them where they're at, whether that's at an encampment or at a Starbucks or maybe a Safeway parking lot. So physically meeting them where they're at, or more figuratively being, some of our clients need a lot more assistance than others. And understanding that during our assessment, that's something we're looking at. We're looking at their ability to complete their ADLs, or what is their trauma history. And we're going through all of that. And while we're doing that assessment, we're thinking about treatment planning and what are they eligible for? What other resources can we connect them to is really a big piece. And then I think the last piece around this would be that the treatment planning is collaborative. The court requires them to be in this program with us. That's part of the agreement. They're getting released from jail to be in JMHCP. And we want them to buy into what they're doing. So we're not going to tell them what their treatment plan is going to be. We're going to sit down and we're going to talk to them about what their needs are, what they're looking for. And sometimes that takes a little more guidance than others. But the treatment plan process is very collaborative. And every case management meeting is, what are you doing next? What am I doing next? See you in a week. And then we meet up and we talk about the progress as we go. Always coming back to, what was on your treatment plan? Are we making progress towards those goals? Allison did a pretty good job actually of discussing how we end up with the clients. Jail is the intercept point. Then the clinician does their assessment in custody, which then screens people into JMHCP. We receive a referral. IFSN will go into custody and we will meet with them first. And we'll do our assessment to see if they're appropriate for the house or in community-based. And then we'll go pick them up and we'll drive them in our cars back to the house or back to wherever their placement might be, if we can make that happen. So we're really starting the relationship as early as possible. We're trying to create positive transference, a positive relationship before release, so they want to engage with us. Primary goal is successfully completing pretrial, but secondary would be housing. And it's not technically written into the grant that our main goal is not housing. Our main goal is helping these clients get through the pretrial process, but we're a housing agency. It's just what we do. So it's very natural for us to have that be a secondary goal for all of our clients, and tertiary goals being whatever it is that they want to work on. Sometimes it's work, sometimes it's Social Security, sometimes it's getting a bike. You never know what the other things might be that they want to work on. So in terms of why we've been able to be successful, a lot of this was already covered in a lot of the other slides around cultivating and creating relationships with other providers in the community, because we can't do it all. Probation can't do it all. We have to lean often on what other resources are available in the county. So relationships with the local public housing authority. As an agency, IFSN has been working with them for a very long time. So they will call us and say, hey, we have 5 vouchers. We got 2 reentry and we have 3 mainstreams. Do you have clients? Of course we do. So they will call us and let us know, and we're able to triage and screen clients into getting housing vouchers because of that relationship created with them. Behavioral health, local Sonoma County Behavioral Health, we work with them so often with this population. Oftentimes they are already on a team, they have a worker. So every Wednesday we are part of their multidisciplinary team meetings, and we do client case management, consultation and game planning on who has what appointments, who's got court on what day, who's going to take them, who's going to make sure they get where and they need to be. Also local clinics, they're also at the multidisciplinary team because our clients are high utilizers of the local medical clinics. Probation, coordinated entry. We are a coordinated entry access point as well. So we are constantly assessing if our clients need to be in that system, and we're getting them into that system as quickly as possible to help them get into permanent supportive housing, rapid rehousing programs. That's kind of one of the main ways that we're helping get these clients housed is through permanent supportive housing and CE. We're also doing a lot of referrals into the county program for housing disability advocacy program. So it's one of the most amazing programs we have in our county. It's long-term for individuals pursuing SSI and who are unhoused. And that is for the duration of their Social Security case until it is awarded, and they're permanently housed. They stay on that caseload. They could be on that caseload for 4 years. So, and they could be on the caseload longer than that, but just so you could kind of get the point, we do a lot of referrals to that program as well. We've had to be really creative because we don't have direct financial assistance. So we can't pay deposits. We don't have any way to actually pay for things for the clients. So cultivating those relationships with other providers locally has been instrumental in seeing better results in housing with clients, and even resource navigation in terms of food stamps, IDs, Social Security cards, really basic, because a lot of our clients come out of the jail and they have nothing. Sometimes they don't even have a bag of clothes. So we're really trying to hit the ground running in terms of getting them their documentation really is the first thing, and then growing after that. So I would like to just finish with a couple of things I wish I knew before. So things that we've had to kind of adapt to, and things we're adapting to right now, honestly. Our county doesn't have any drug treatment programs available for these clients right now. So we're seeing a lot more clients who realistically need more resources, but there aren't any. So as an agency, we have become a Narcan provider. We have Narcan at all of our transitional houses. We keep it in our lobby. We give it to clients because that's going to be something that happens more and more because there's less resources and support around drug treatment. So we do Narcan trainings with our agency. It's one of our core trainings. Everyone has to have it. So it's been difficult because we had more treatment at the beginning. We've lost it as we've continued on with this grant. So we're looking to try to find ways to create more resources where there aren't any right now, like potentially hiring AODS clinical staff so that we can be able to provide that in-house versus having resources from somewhere else. So that's been a struggle for us. I think Allison would agree. And the timing issues. Sometimes someone's in jail for 12 hours. So sometimes they get in and out really quick, and there is a very short amount of time to intercept to get them referred into the services. So we're also talking about potentially adding a drop-in day. So people who are on pretrial release level 3 can come in and we can do an assessment and see if they qualify. So we're trying to come up with new things to solve problems. But I know we're just about out of time, so I want to leave the last couple minutes in case anyone has questions or or anything for us.
Right. Well, thank you both so much. I feel like we could probably talk about this easily for like another 2 hours. We don't really have any more Q&A time, but I'm sure, you know, if you'd be willing, if you want to put your emails in the chat, if folks want to shoot you, you know, an email follow-up question, that's where we'd love to stay connected, you know, continue this great conversation. But thank you so much both for all the great work that you're doing and being willing to share today. I'm just going to do a super quick wrap up to try to keep us close to on time. And yeah. So next slide. Next slide. All right, so here's a link to our action points brief that I was talking about earlier. And again, this will also be in the slide deck that we send out. Next slide. We also had a webinar series that we did last year that was directly based on this action points brief, and it goes deeper into strategies and best practices around each of these steps. So definitely encourage you to dive into those recordings as well. Next slide. Please come back to our next session in this series and tell your friends and colleagues. We'd love to get some more folks in the group. The focus is going to be upstream jail diversion with housing. You know, so really, session 2 is really going to dive a little bit more into the law enforcement focus. We're going to have a couple of our law enforcement mental health learning sites join us. Basically, they have been doing this work, and Wichita will be one of them. They have been doing this work for a number of years and have volunteered to sort of help train and mentor other folks. So they're going to come and share what they've learned and be here to take questions and dialogue. So it should be really great. We got the registration link here, and I'm sure you know, Thomas or Ethan will also send it out to everybody who participated today. Next slide. So thank you again so much for being here. I think this was great. It was great talking with you all. You're all doing great work, and we are always, as always, we are here to support you. So thanks again, and have a great rest of your afternoon.
Take care, everyone.
Thank you. Thank you, everyone.